let's get cracking. Boosting energy levels. So what's that really all about, right? That for me is, question is, why has someone got low energy in the first place? Probably needs to be the question, right? And we could all do with more energy, right? We could always, no one's going to say, oh yeah, I've got as much energy as I want. Well, some people might, but you know, we can all do with more. And I tend to sort of work through with patients. I tend to look, when someone says I've got low energy levels, I tend to go through a sort of a like a list of certain things to sort of rule out and rule in, right? And then there's some stuff is more obvious than others, right? So the first thing I'm thinking of is thyroid, let's say. And the problem with thyroid is that most of the time, the most famous thyroid researcher of all time was a guy called Dr. Broder Barnes, who the underarm temperature test was discovered by. And he wrote a book many years ago called Thyroid, the Unsuspected Illness. So the clue is in the title, it's unsuspected. Dr. Karezian in America has written a book called Why Do I Still Have Thyroid Symptoms When My Blood Work is Normal? Again, the clue is in the title of the book. But many patients have thyroid dysfunction or subclinical underactive thyroid, and their blood work is normal. And what quite often happens is your doctor will say to you, oh, your thyroid markers are normal, you must be depressed and have depression, and you get given antidepressants. And that's quite a common pattern I've seen with patients over the years, and the patient isn't depressed at all. They've got something going on with their thyroid. Your more traditional symptoms of thyroid dysfunction would be fatigue, cold hands, cold feet, would be the most common two. You know, then would be things like dry skin, brittle nails, and hair loss, right? So that needs to be addressed. And also another thing to consider is when you go to your doctor for your thyroid blood test, they may just be measuring TSH, which is thyroid stimulating hormone, and T4, which is one of your thyroid hormones. But they won't really measure the active hormone, which is T3, or antibodies. And there's actually probably about 15 different markers we can run for thyroid at the clinic, but if you're lucky, you'll only get 2 or 3 done with your GP. Even when I see patients who have 15 thyroid markers that are normal and they've got more classical thyroid symptoms, I would still provide them with treatment. It's better to treat a patient than it is to treat a piece of paper. So you've really got to work with what's clinically in front of you, regardless of what the test results say. So what's that saying? It's like, if it walks like a duck and it quacks like a duck, it must be a duck, right? So the thyroid is really important in assessing people with their energy levels. We also then have to look at adrenals, and adrenals are, you know, your adrenal glands sit by your kidneys, and they tend to pump out hormones called cortisol, adrenaline, DHEA. You'll produce more stress hormones, especially cortisol, in times of stress. But stress was designed for, you know, when we're running from a proverbial lion, but now we're using our stress hormones even for stuff that really isn't an emergency, such as, oh, you know, I'm running late with the kids for school, let's say. And what happens is when we're stressed, is that we will eventually get either low cortisol or cortisol resistance. And as a result of that, we can be quite fatigued. And there's different sort of stages of, you know, fatigue with adrenals. And at worst, you know, people can get to a stage where the body just really isn't producing any cortisol and has very low DHEA. And you get to a place where people commonly know it as burnout. Yeah. And burnout, as some of you may have experienced this, is not fun, right? And I've been there myself. I know what it feels like. So when you're burnt out, you know, your resilience is incredibly low. Your immune system won't work properly when you're quite adrenally stressed either. So as a result of that, you're going to pick up infections really easily, and then you're going to feel more fatigue as a result of the infections. You're in this sort of vicious cycle, right? And again, that type of stuff needs to be, you know, sort of ruled out. And one of the things I look at with patients might be things like, I'll say to patients, you know, the problem is we live in a society, right, where there is a very socially acceptable form of addiction, and that's workaholism, right? And people accept that. But the problem of being a workaholic is that there's much more tendency then to burning yourself out, overworking, and as a result, getting fatigued. And I do see this an awful lot with patients. There is overwork, or people have had a long period of time of overworking without a break, or not having holidays, doing 7-day weeks, doing 100-hour weeks. And then they collapse, and not literally, but their body just says it's had enough, and then they end up with all sorts of weird immune dysregulation symptoms, or they have like pains in multiple places, autoimmune conditions, mast cell issues, and a lot of the sort of complex conditions that we see at the clinic. So that's, I think, lifestyle for me is very, very important when talking to patients and understanding their backgrounds, their work schedule, how many flights they take a year. I mean, I was on a call to a patient this morning, a prospective patient, who at her busiest will do 120 flights a year, and at her average will be doing 60 flights a year. Now, that even at 50 flights a year, that's a lot to do, yeah? On the body, the strain, obviously airplanes are still using leaded fuel, you're exposed to lead, obviously cars don't tend to use leaded fuel anymore. There's quite a high lead exposure. There's a lot of oxidative stress with flying. And if you're moving through time zones and you're doing that, 50 times a year, that's, you unless you're really taking extra care for yourself, I think even no matter how much care you're taking for yourself, you're going to struggle in one way, shape or form with that many flights. So that's sort of just a quick look at adrenal stress and thyroid with fatigue. And then the next thing I would probably look towards with patients when I'm looking at fatigue and energy levels would be some type of anemia, yeah? So obviously classically we're thinking of iron deficient anemia, but there are other anemias. There's folate, there's B12, there's vitamin C, there's copper, yeah? So that's other areas to consider as well. And also, again, when you're looking at, you want to see a full iron panel when you go to your GP. And I'm actually more interested, really, I know the gold standard is ferritin, but we haven't got the time today to have a whole, because I could talk for an hour on ferritin, but I'm not a big fan of ferritin. I actually would prefer to look at the red blood cells, the hemoglobin, the MCV, the MCH, and the MCHC, and also an iron panel with percentage and saturation and total iron binding capacity. For me, is more important than actually looking at ferritin. So, because ferritin is a protein in the body, in short, that can rise and it can fall with a whole myriad of other outside factors that have absolutely nothing to do with iron. And actually, ferritin will rise quite easily when there's a lot of inflammation in the body. So quite often you might find that your ferritin is, say, 70 or 80 or 100, even as high as 300, but your iron can still be low. And you can still be suffering with anemia, even with high ferritin, right? So I wouldn't place everything on ferritin. And again, looking at things like B12 anemia, when you go to your GP, you're measuring serum B12 in the reference range in the UK starts at around 200, goes up to about 1,000. In Japan, the reference range starts at 750. So if you're anywhere between 250 and 749 in Japan, you'd be considered deficient, but anything in that range in the UK, you'd be considered normal. For serum B12 to be low, it's got to be really, really, really low. Because serum B12 is not the best way of measuring B12. It's much better measured in the urine or in the blood in a marker called methylammonic acid, right? So many patients are often deficient in B12. And one of the best ways of replenishing this is by B12 shots. Even if your B12 is normal, using therapeutically B12 injections can work well for some patients, not just vegans. There are some patients who eat an omnivorous diet, I find, and some patients will go anywhere from injecting B12, self-injecting at home, anywhere from once a week to even once a day in severe cases. And some patients do really well with their own self-administered B12 injections. Obviously, B12 can be taken in supplemental form, and I tend to quite use like lozenges, quite good for absorption, and they're quite tasty as well. So anemia is something to be mindful of. Copper, best way of knowing with copper is in a marker called cerebroplasmin. When copper is low in the body, again, that can be copper-based anemia, can be causative with patients feeling fatigued and not having the right levels of energy. So next on my list was nutrient deficiencies, which obviously ties in with the copper and the B12 and the iron we're talking about. Your thyroid hormones are made from iodine, T3 and T4. The T stands for triiodinine. So the difference between T3 and T4 is that there is one iodine molecule difference between the T3 and the T4. So you need iodine not only for your thyroid to work properly, but for a myriad of other functions in the body. So people may well be iodine deficient. There's a whole heap of nutrients that are useful for energy metabolism in the body. Some of the more common ones would be things like magnesium and zinc, but also the B vitamins, like B12 is really important, B6, B1, B2, malic acid. So a good B complex and magnesium taken at least the RDA, so perhaps in the form of magnesium malate, because magnesium malate tends to be one that's better with the Krebs cycle from energy production. I also think that there are nutrients and things you can use therapeutically to help with when you have low energy levels, although I'm not necessarily a fan of giving someone something just to boost their energy levels, because you want to find the underlying cause, or I do anyway. But there are certain herbs, you can use adaptogenic herbs and things like specifically like rhodiola and some of the more like medicinal mushrooms, which are more focused around resilience, like cordyceps and reishi and things like that, can be very useful for resilience and are good adaptogens as well. I would also like to mention that no talk about energy, would be a talk about energy and boosting energy levels would be a good talk without talking about the mitochondria, which are known as the energy powerhouses of your cells. And mitochondrial dysfunction can occur with many patients who are experiencing low energy, and certain nutrients are very important for the mitochondria to be working properly. A lot of the ones I've already mentioned. There was a very good test from Germany. The technology is known as the seahorse technology, and there's about 10,000 citations in PubMed on this test now. So it's a very good gold standard test for measuring mitochondrial function in patients. And I quite like doing that from time to time with patients where I believe there's a mitochondrial issue. You can use organic acids in the urine as well, but both of them are quite good. But I do like this test from Germany, and it can also indicate whether a diet high in fatty acids is good for you or not, whether you're favoring carbohydrates more in your diet as well in terms of use for energy. Because a lot of people, like some people have been getting into the habit of doing, say, like the keto diet, which is quite a high fat diet. And that doesn't suit some people. And some people feel really rotten on the keto diet. And one of the reasons why people can feel that way is because the body has to use a process called glycolysis to burn fatty acids as fuel, right? And if that pathway and process is impaired, then the body can't burn fatty acids as fuel, and people are actually going to feel worse for being on a keto diet. So this test from Germany can actually differentiate and tell you what pathway your body is differentially preferring. Yeah. And the mitochondria, if the mitochondria aren't working properly, we have to ask ourselves the question, well, why? And has something poisoned the mitochondria? And is there a reason why they're not working properly? And I tend to find toxins and oxidative stress are the biggest causes of the mitochondria not working properly. What we now know, the best evidence we have, and I've mentioned this in other talks I've done, webinars I've done recently, is that when people have long COVID or vaccine damage, what we now know is that the mitochondria have been poisoned, and what the patients are suffering from is spike protein toxicity. The mitochondria get damaged, there's mitochondrial dysfunction, and the patients are feeling tired. So that's something to be quite mindful of. And also that links into, if we're thinking of things like long COVID, we obviously, what my mind is then sort of moving towards is looking at other forms of post-viral fatigue, such as, terms like chronic fatigue syndrome, post-viral fatigue, or ME. Yeah? And obviously chronic fatigue, or CFS, is caused by a number of factors, some of which I've already mentioned, thyroid and adrenal imbalances, some type of anemia, mitochondrial dysfunction. Yeah. Physicians will give people a blanket diagnosis of chronic fatigue syndrome, but that doesn't really tell you anything, does it? It tells you you've got fatigue, you've got chronic fatigue, but that doesn't really tell you what the causes are, right? And unfortunately, the conventional NHS approach to chronic fatigue syndrome is like really stuck in the dark ages. I think it's graded exercise and CBT, which we now know, most patients know, doesn't really work. So again, looking more at chronic fatigue syndrome and long-term fatigue, We need to consider latent infections, which is quite a common one, specifically things like Epstein-Barr virus, HHV6, which is another virus, or even now, obviously, we have to look at COVID as well. And our patients dealing with latent infections, those infections that are, the body is sort of sitting there, they're historic, could be 10, 15, 20, 25 years old. And have they been reactivated? Because we now know as well with long COVID or people with vaccine damage that we are seeing quite a lot of reactivation of Epstein-Barr virus, which is the most ubiquitous virus, and which is often associated with, amongst other conditions, but more associated with Hashimoto's thyroid. Yeah. So I think one of the approaches that I quite like using with patients is, if there's latent infections, is supporting the immune system, trying to get rid of the viruses in the body. But most of that tends to come through herbal medicine, with herbs that are immunomodulating and antiviral. And obviously, there's a whole, we could do a whole talk on latent infections, but there's dozens of viruses. There's gastrointestinal bugs. There's H. pylori. There's obviously Lyme disease, which we treat a lot at the clinic. And many of the patients we see at the clinic have got latent infections with Borrelia burgdorferi, which is the bacteria that causes Lyme. Even if you haven't noticed a tick bite or haven't had that before, the larvae of the ticks are microscopic. So you won't necessarily have seen them on you. You could have been bitten at some point. You may have had like a flu-like illness 15, 20 years ago. But you now may well be doing that latent infection, the body that's been happily dealing with that. Previously, you're now not able to deal with so well because you've had a stressful few weeks, few months, you've had a death in the family, and homeostasis hasn't been maintained by the body as a result of stress and trauma. Your body then becomes fatigued because it's not dealing with the things it was happily dealing with previously, and it starts making mistakes. And when it starts making mistakes, you end up with elements of mistaken identity, which is basically what autoimmunity is. So also, I think that, again, with fatigue, we need to, and I will have mentioned this in the other talks, is considering trauma, historic, inherited, and developmental trauma. Yeah. So if there's been aspects of inherited and developmental trauma or adverse childhood events, there is a much higher chance in adult life that people can develop fatigue-based conditions. So again, if that trauma is not dealt with and is not processed and cared for, then that may well be the stumbling block to someone being completely well from a fatigue-based condition. And we know that from Vessel Banderkoff's work, The Body Keeps Its Score, the body tends to hold this stuff. And it's important to find some outlet or means. Therapy, often like in some form of embodiment work, is very good, like the somatic experiencing, like Peter Levine's work, is a very useful technique, although there are many others. Again, another thing that needs to be mentioned is toxins. And many people can feel tired because of a buildup of toxins in the body. We now know we're exposed to hundreds of thousands of more toxins than we were even 75 years ago. And the body has had to find ways of dealing with this via its detoxification and biotransformation processes. And, some of the more common toxins that the body's having to deal with are things like heavy metals. And most of the good chunk of our exposure is in the atmosphere, it's in the environment, but also especially things like mercury, it's in dental materials, where we've had amalgam fillings. Mercury is the most toxic substance known to mankind, other than plutonium, which is man-made. So that's something that needs to be detoxed from the body. If patients have got amalgam fillings, they really need to be changed to white ones by very, very safely by a biological dentist that follows the SMART mercury amalgam removal technique. And other toxins are things like lead. It does take quite a while to get lead out of the body, and that can be done through urine testing or blood testing. Things like arsenic can be problematic for some people. Also, other dental materials that patients have can be issues as well, like nickel can be an issue in terms of the dental compatibility of patients. And we will do things like some of metal sensitivity testing to see if patients have lost immune tolerance to particular metals in their mouth. And if they have, then that's something that can be quite beneficial to patients. Again, especially things like titanium implants. A lot of patients have had titanium implants. And what we find is, although they're called titanium implants, all titanium implants do contain a small amount, maybe 5% of aluminium. And some patients have had loss of immune tolerance to aluminium. And so that's something to be mindful of. And sometimes when patients have titanium implants removed, even in their ankles and plates and things like that, and they've had chronic fatigue syndrome for numbers of years, they find after the removal of certain implants in their body that their fatigue symptoms dissipate and disappear. In the same way, actually, it might be worth mentioning is that some ladies who have had breast implants historically have felt very good relief years later after having their breast implants removed, and they've had issues with the silicone and element of immune reactivity. That's obviously there's no guarantee when we remove any form of implant that we're going to feel immediately better, but there are some patients who feel better, and then obviously there's some patients who feel no different. So there are obviously no guarantees. However, if a patient has, say, very, very high levels of mercury on testing and a mouthful of amalgam fillings, and they've got a lot of fatigue and other health symptoms going on, to me, that would be a very wise decision to have those changed, given the levels they might have on testing. We've got I've been through probably a whirlwind tour of, I think, what amounts to patients coming in with fatigue issues and what may help with energy levels. I'm not, as I say, I'd rather not run through a list of take A, B, C, D, and E to boost your energy levels, because that's really not going to get you to the point of why is my energy low in the first place. One of the things I should actually mention, which is really important, is sleep and coffee, right? So to have good energy, you need good sleep, right? And sleep is not just going to bed, hitting your head on the pillow. Needs to be good quality sleep. And what do we know about good quality sleep is that there needs to be a reasonable amount of deep sleep per night, and then the rest obviously be REM and light sleep. Yeah. So deep sleep should really be about, ideally up to 20% of your sleep should be deep sleep, another 20% REM sleep, the rest would be light sleep. And the problem with coffee is, I see this routinely, is that, and you'll meet people and they'll say to you, oh, I can have an espresso before bed and I sleep fine. Or I can drink coffee any time of the day and I sleep fine, right? What these people don't realize is that they may think that they sleep fine, right? But the quality of their sleep, if they measured it, and you can do it on devices such as an Oura Ring like this, and other such wearables, they will find that their deep sleep and their REM sleep is actually very low. And most of their sleep would be light sleep. So the quality of it. And what we know is that caffeine basically interferes with something called adenosine in the brain. And you need adenosine to be working properly in order to give you the sleep that you need. So if adenosine sounds a little bit similar, similar ending to caffeine, right? And also the half-life of caffeine, is about, it's almost sort of like, it's 10 to 12 hours, right? So realistically, you shouldn't really be drinking caffeine after 11 o'clock coffee in the day. If you're having issues with sleep or anxiety for that matter, it's a bad one for anxiety. If you have any issues with coffee, so with sleep, my advice is to have any form, and even if you don't have issues with sleep, my advice is to have all your caffeine in the morning before 11. So for example, this morning I have a double shot in the morning at around 8 o'clock-ish, 8:30. And then I'm actually sitting here somewhere around here with a decaf now. And I tend to get my coffee through Exhale Coffee, a brand called Exhale. All their coffee is lab tested for impurities like heavy metals and mycotoxins, has very high levels of collagenic acid and antioxidants in it. And their lab work, which is fascinating, shows that they have more antioxidant in one of their espressos than 10 punnets of blueberries. Sounds far out, but it's true, but it was only based on the lab work anyway. So that's the brand I would highly recommend is Exhale Coffee, because it is definitely probably the only healthy brand of coffee out there. And I think when you feel jittery with coffee, it's often the impurities rather than the caffeine a lot of the time, rather than some people feel jittery with it. So that's probably my whirlwind tour for you for energy levels. If people want to ask any questions, they can do so in the chat. We've got a few minutes if people want for questions. All these talks will be recorded and they will be made available in the next week via a YouTube site. So if people wish to listen back on them, the other ones in the series, they can do so. Yeah, we'll just wait. I'll just hang around just for a few minutes, see if anyone's got any questions they'd like to pose in the chat box. And other than that, if we don't get any questions, then we will, I will, close the webinar. Someone has asked, how do they find a dentist that will remove amalgams properly? Great question. So in London, I tend to recommend the NDU clinic in Harley Street, who are really good. They're very good sort of one-stop shop in terms of the different services they have to offer there. They're a great one-stop shop. They even have their own cone beam CBCT scanner there as well. So that's one of the reasons I like them. They do implants there. They do all the biological services you'd like. I quite like Elite Dental in Marlow. They're good if you want a Marlow outlet. There's also Beta Fox in Bedfordshire at the old Munro Hall Clinic. She's very good. If you need to be further north, then there's John Roberts up north. I think it's Huddersfield way. But again, if you're looking to have amalgam fillings removed, I definitely wouldn't have them done with your normal dentist. Otherwise, you'd be causing yourself more problems. So I would look for a dentist, and you can find this online, who's done the SMART approach. SMART is safe mercury amalgam removal technique, and all those dentists will be members of the IOMT, which is the International Oral Medicine and Toxicology Society, and you can search via the UK website for practitioners who will be offering that. So yeah, that's the answer for you, Elaine. Any other questions? Yeah, so Elaine, Helena Estefez, Elite Dental Marlow, can have a bit of a waiting list, but she's great. Helena, Portuguese lady. So any other questions, guys? Well, that's good. It looks like I might have covered most things then. So yeah, thanks very much everyone for attending today. And obviously, if you do need any help or assistance with your health journeys, please do get in touch with the clinic. And you can always book a discovery call to who might be the best clinician for you if you need help. We've got about a team of about 10 or 12 physicians who have different areas of speciality. We cover quite a broad range. We even got one lady in the team who specializes in Parkinson's disease, one lady who specializes in cancer. So yeah, we cover most chronic health or health optimization sort of angles for patients. Someone's asking, Farida's asking, can you test for long COVID? I think she's asking, Ling Coving, but I think she means long COVID. You can test for long COVID, but we're looking at the causes of long COVID. So not specifically, there isn't a long COVID marker per se. You could have high spike protein antibodies, which can linger. That can be a clue, right? If you've got lingering spike protein antibodies. But I would nearly always go to the German test and looking at the mitochondrial markers, because again, most patients from a lot of the research that I've been exposed to is that most patients with long COVID have spike protein toxicity, which is causing damage, and it can be measured and measurable within the mitochondria. One thing I should mention as well, where there's good promise of long COVID as well, is hyperbaric oxygen. And we do have a partner down the road from our clinic who does hyperbaric oxygen therapy. Oh, and also spermidine. We offer spermidine IVs at the clinic, and spermidine, a few of my patients, has been really useful for treating long COVID amongst everything else we do. So using spermidine IVs. The German test is available through the clinic. Yeah, it's I can't remember the exact name of it, but yeah, we only offer there's one German lab we use for mitochondrial testing, and it's using the Seahorse technology. So a full panel with the German test, full mitochondrial panel, is about £600. There are lesser panels within it. You could spend £300 or £400, but to get the most complete picture for very detailed analysis, it's about £500 or £600. So yeah, thank you very much, Farida. So we'll end it here. Thanks everyone for joining today. and we'll be in touch.